Sounds good.
All right, everybody ready?
Yep.
All right, Connor, are you ready?
Yep, you can take it away whenever you're ready.
Okay. Pursuant to Chapter 20 of the Acts of 2021, on June 16th, 2021, Governor Baker signed into law an act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until April 1st, 2022 of the remote meeting provisions of his March 12th, 2020 executive order. This meeting will be conducted via remote means. Members of the public who wish to access the meeting may do so by using the webinar link posted on the town website. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so for reasons of economic hardship or despite our best efforts, we will post on the town website an audio or video recording, transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. This meeting will be live streamed via Westwood Media Center, and the public can view the meeting by accessing the link on their channel. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center live stream. The public will be allowed to make comments if they wish to do into the chat box. The chair will give guidance and instruction as needed to access the comments during the portion of the meeting reserved for public comments. Okay, take it away, Roger.
With that, I will call the meeting to order. I forgot to print the agenda, but I assume we have to review and accept or revise the minutes. Is that correct?
That is correct. It would be the approval of the minutes of June 15th, 2021.
I reviewed those, and personally, I've found them to be acceptable and complete. Does anyone want to make a motion about accepting the minutes?
Sure, I motion that we accept the minutes.
And I second.
Any discussion? Hearing none, let's call this for acceptance. All those in favor indicate individually your name and your feeling about the minutes.
I, Carol Ahern, accept.
I, Shelley Reaver, accept.
And I, Roger Christian, accept as well.
Okay. All right. Thank you. So let's jump into sort of the purpose of us being here is to sort of give you all an update as to what's been going on townwide. Obviously, when we met back in June, the feelings amongst our group were a little bit more jovial than they are today. The specter of COVID-19 and the Delta variant has sort of brought us back down to the reality of the day, which is that we still need to be very diligent in our practice and in our work here in town to make sure that we reduce COVID-19 transmission to the greatest extent possible. So before I get into some of the stuff that's just come down, I just would want to kind of give you an update as to where we were after our last meeting. So we had a pretty good run from that meeting until about mid-July, where we didn't record any cases really at all. I think we ended up with 2 until about mid-July, and then we started to see a little bit of an uptick that last week of July, and then the first week of August. Started to see numbers jumping up where I felt it was significant enough that we alert the community, which I did via a Westwood alert email, which kind of gave the public that maybe wasn't logging on to the mass.gov website any longer, kind of feeling like things were behind us, maybe just give them an alert that things were moving in a different direction and they should be aware of it. So most of the cases that we saw, they really ran the gamut of the age groups and the different demographics. In the memo, the first week of or the second week of August, from 8th to the 14th, there were 14 new cases, and 5 of those were in children under 12, which is the age group, obviously that's not eligible to be vaccinated. There were 2 cases in their 20s, 2 in their 30s, 3 in their 40s, 1 in their 50s, and 1 in their 60s. So, we're still seeing a spread of, pretty close to 50% of those cases are people that are fully vaccinated, which, is unfortunate, but since we have such a high vaccination rate, is probably not unexpected. I think we talked about that in June, that since we have such a high rate, and if the actual infection protection rating of the vaccine is like 80%, that still means 20% of those folks that are vaccinated will still contract. So that's kind of what we're seeing is a pretty good amount of breakthrough cases, which seems to be directly correlated to our high level of vaccine, fully vaccinated individuals residing here. So in a way, we can kind of accept that as real on the ground data and move on to look at the impact or severity. We're not seeing anywhere near as much in terms of highly ill or hospitalizations, and we haven't had any recent fatalities. So as sort of indicated in the rollout of the vaccination program, being fully vaccinated tends to align itself with a better outcome. So obviously, we're happy that the data is supporting that, and that gives the people a lot of comfort and assurance that those who are fully vaccinated, should they contract COVID, will most statistically have an easier go of it. So moving through the month, heading into this week, we had a little bit of a dip. So we had this little bit of a spike, and we kind of all got a little bit on edge, and so we sent some sent some information out to the town, and then now we're really zeroing in on cases, and now they're sort of trailing down slightly, from 15 to 11, or from 12 to or from 16 to 12. So we're kind of every day watching it. We're kind of back to that every day watching for new cases, for clusters, for in household spread, trying to continue to intervene through contact tracing and notifications to keep people who may be infected from transmitting to anyone else, getting them in quarantine program and getting them advised about testing, etc. So, I think in a lot of ways, what we're doing now and what we're going to be doing for the next, 4 to 6 weeks hasn't changed much. It's ears to the ground, watching, reports come in, following cases, contact tracing, and sort of the same process we have been doing. We're going to continue to prioritize, the younger demo, the younger age groups, because we feel like, we can get to them more quickly. They have larger groups of close contacts. They tend to, through their social activities inside and outside of school, they just tend to have larger social circles. So there's more opportunity for transmission there than, with other folks who may, live at home and work and kind of live a relatively banal lifestyle like I do. So, that's gonna be probably our focus, certainly in the next 2 weeks. So we did have one case in the summer school program. We did have a couple of cases in summer camp, but all in all, I would say the childhood group 12 and under was still relatively well protected. I just feel like we also take a moment to recognize our 12 and ups who have stepped up in a remarkable way to get vaccinated. Our numbers are exceptional, and I think we should all be very proud of our especially our younger residents who have stepped up in a major way to make sure that they protected themselves and their friends and family too. Comparing our rates to other towns, we have really have a very high rate. So hopefully that, when the day comes when the 12 and unders are approved, we'll continue to be able to, to enroll those students and children into the vaccine program, and start to see a consistent percentage in that age group the way we have for all of our others. Other things on COVID related, obviously, FDA gave full approval for the Pfizer. So that is now, outside of EUA, it's now a fully approved vaccine. So that will change slightly a little bit on the, on the fact sheet that gets distributed at the point of vaccination, but is not going to really probably change that much in terms of how we manage what we do day to day. There is recent guidance from CDC about third dose for certain individuals that have immunocompromised health statuses. And we were just on a call prior to this one where DPH did speak to this, and they're recommending that anyone who thinks they might fall into that category consult with their physician on whether it is appropriate for them to seek out their third dose, and that discussion should be had. As of right now, there are no plans for large scale clinics, either by the state or locally. These additional folks who may be medically advised to obtain a third dose would get it in their regular office or at a regular clinic or at a CVS or Walgreens or any other place that is still doing vaccination. So more news will come on that, I assume, soon from DPH, but that's kind of where it stands as of right now. The last conversation that we just had. So I don't know if any of you have specific questions related to where we are in terms of COVID. I mean, our percent positivity is still in the lower twos. So we're still sort of on the lower end of the upswing. So we're going to try our best to intervene at this point and hope we can keep it that way. No. All right. A couple other things. First thing is West Nile and Triple E, which we did get an alert the week before last from the arborovirus surveillance program that they detected a positive West Nile virus mosquito in sampling that they're doing in town. So they have sampling traps set up in towns all over, and so they pulled a batch out of one of our sampling traps, and it did test positive for West Nile, which means infected mosquitoes are in the area. It doesn't necessarily correlate to those mosquitoes being able to transmit to individuals, but pursuant to the recommendations that we always put out, we issued an email alert advising folks, to take the usual precautions when outdoors, especially at dawn and dusk, longer clothes, using an insect repellent that has DEET, minimizing their time spent outdoors when during those times, and avoiding high mosquito areas where people tend to see large amounts of mosquitoes present. You want to avoid those areas if you're hiking or outdoors fishing or walking your dog or whatever. You want to choose more open space with more wide pathways. The mosquitoes tend to sort of harbor themselves on the lower points of plants and trees. So if you're walking through a heavily wooded area and you're seeing foliage at shoulder height, chances are underneath that lower level of leaves is where you're going to find these mosquito populations hiding out. So you kind of want to think about finding open space when you're outdoors in those areas where you see a high proportion of mosquito activity. But our what Triple E alert is still low, so thankfully that's not as of yet an issue that we need to reckon with. So, obviously we're monitoring it every week and we're waiting for more information. We'll see what comes, if anything, and we'll notify the community appropriately. The only other issue is we did have talks again with Wegmans about doing another annual flu clinic. We have a tentative date, but the paperwork has not been signed. The contracts are not yet done. So we probably will have an announcement at our next meeting. Hopefully we can get all that stuff together, but it'll run similarly to the way we did it last year, where people can register and then come over to the area behind Westwood High, where we'll have our little area set up to do it outdoors. We thought for a moment we could move it back indoors, but it seems like with a lot of uncertainty here, this will be in October. So we're looking at, probably doing it outside is just, a better play safety wise. And most people I found were fairly comfortable outside, and nobody seemed to really have an issue with it. I quite enjoyed it for my own participation. So looking forward to that, and grateful for the partnership there with the pharmacy at Wegmans to offer a service for us. So other news that's kind of where we are. So I don't know, I probably, we're obviously continuing to work with our partners on school side and our partners on police and fire, as these interactions with the community, and helping everybody sort of manage their scenarios in relation to their COVID transmission risks. I have a few conversations here and there with RAC and with the library, and I suspect as we move back into school year levels of activity, and folks who've been away kind of come back to town, more and more of these conversations will be had. So I think that's all I have for today. I know Margaret might have a little bit of an update from the public health nurse perspective. So Margaret, if you'd like to jump in at this point, please.
Thank you, Jared. I guess I'll just update the other things that have been going on minus COVID. So ticks continue to be, an ever-present problem in our community. We, again, have been spending time telling people to, be outdoors to avoid COVID. And then part of the great outdoors, we find ticks. So in addition to Lyme disease, we've had 3 cases of babesia or babesiosis, depending on how you want to say it and pronounce it. Again, another tick-borne disease, the same tick that transmits Lyme disease can cause this as well. Some studies will show that it can be transmitted along with Lyme in up to 50% of cases. So the symptoms can be somewhat overlapping and the same. One difference in this is that it can also cause hemolytic anemia, which is a breakdown of your red blood cells, and that can cause some shortness of breath, which you don't typically see with Lyme. So infectious, but not contagious. We did have 1 case of influenza B, just 1 single case. Doesn't seem to be travel related or have extended beyond this single case that we've been able to find in our community. 1 case of legionellosis causing typically what you find in these people are cough, fever, chill, shortness of breath, and pneumonia. Does seem to be an isolated event, non-communal setting. Worked with the Department of Public Health on this one. And finally, 1 case of hepatitis C, a viral illness that can be, bloodborne, needles from drug use, but, anything that's really sort of a blood-related contagion can do it. I know a lot of primary care doctors are doing this as part of routine screenings now, so we definitely see some cases pop up from time to time. People aren't necessarily symptomatic. People, I think, are just doing a better job looking for it, which is a good thing. That's it.
Thank you.
Jared, do you want to make mention of anything about today's comments from the Education Commissioner, Riley?
Yeah, thank you. So I think a lot of public discussion has been centered around, what is the best way to protect our students when they go back to school. And, there's been a lot of discourse, obviously, across every town, every state in the country, probably every corner of the globe about face coverings, face masks. So, the Department of Education, Department of Elementary and Secondary Education did get approval. The commissioner did to implement a mandatory mask mandate for K through 12, regardless of vaccination status. So through the Department of Ed powers in terms of how the schools operate, they are able to make that order to all public schools in the Commonwealth. So I believe he still needs to actually implement that. It's just he has been given authorization to do that. So we all suspect that will be done in short order, requiring everyone to start the school year with face covering mandates in place. Now there is some relief there, towards the end of September, looking at vaccination rates and looking at data and maybe giving some schools or some grades, additional flexibility to maybe go back to some sort of mask optional, school time if those community cases are significantly low enough that it would seem safe. So it's been a lot of discussion. We've all had it, us in the school side and the school's public health advisory group, and internally and with members of the community. Very strong feelings on both sides. We are all, I think, in the same position that none of us want to see these kids back in school wearing masks. I think that since the Delta data, is still sort of forming, it just seems like a reasonable approach to incrementally start the year this way and sort of, I guess, see how things transpire once, our students are back in school, with some of the protocols in place, but not all. And I think that's important to remember. The 6 feet social distancing that we had last year is now been removed. That's not a requirement. They're recommending 3 feet, but in many schools, those students can't be 3 feet. What about meals? We had a lot of discussions. Well, they're recommending 3 feet at meals where the children are unmasked and eating. So they're, some schools aren't going to be capable of doing that. There's ventilation is still going to be there for many schools. For our schools here, I know they're back and forth on tents to give them extra space, but all those spaces that were converted to classroom spaces, are not available now that everybody's back. So, we sort of had to, I think, try to use our best judgment and, in what protocols we're going to be in place when the kids come back. And I feel like, we can watch for a few weeks and we can see how things unfold. Hopefully we'll get word by mid-fall, early fall about the vaccine approval for 12 and under. And I think that might help. It seems to me as, we've had this internal discussion about when we're going to shift sort of the public health view of managing COVID-19 to, transmission reduction to negative outcome reduction, which would be, serious illness, hospitalization, and death. And I don't see that day coming until at least the 12 and under are eligible for vaccination. I think the order of the day that we get from DPH is still going to be reduced transmission, reduced transmission, reduced transmission. So as long as that is our marching order, these protocols, need to be part of our toolbox. And as much as we're all sort of wishing it wasn't so, I think we need to at least, for now, kind of accept that it's necessary for us to move forward to, with the school's goal of keeping students in person with as minimal disruption as possible. Contact tracing, close contacts, isolation and quarantine, all of those things are still part of the world. So we want to try to reduce the opportunity for those students to be deemed close contacts and be sent home on quarantine. That's the worst case scenario, after obviously getting sick. So if masks help that, obviously we'll probably look back in a month and say, oh my God, I can't even believe we were debating that. Like, what a no-brainer. So so that's kind of, I guess, where I sit on it.
Just want to say I appreciated Carol's suggestion to listen to the public comments from the school committee meeting last week. It was very enlightening to hear what parents are thinking, and I think it's good for the school department that the decision for the next month is already made, so that they're not in a position of having to choose which side to. I mean, I think there was a pretty clear majority in the parents' feelings, but still, I was pleased to see in the Globe today that the commissioner had made the decision.
Yeah, I mean, it's definitely, the story of the pandemic for us in terms of policy is balancing, local control versus, state mandate. And in a lot of ways, we all want local control, but we also, being a small town and surrounded by other small towns, if we're all doing something different, it creates a lot of challenge. And just because, if, we saw this at the beginning when, we were kind of watching the first few months of the pandemic, or at least the first 2 months, there were cases in other towns where there were 30 cases, and in Westwood we only had 8. So I was like, oh, wow, we're okay. And slowly but surely, the numbers went up, down, and sideways. And the next thing you know, the cases were up and then down. And then, so, we're just not able to exhibit local control in something as, as difficult as a virus as we are to exhibit local control with, zoning or different street sign. Like, it's a different thing. So, in a way, these, maybe even countywide, which was what we were doing at the beginning, makes more sense than townwide or citywide, versus, what we're doing in Western Mass versus what we're doing here in Norfolk versus Suffolk versus Middlesex County. Like, that to me seems like a bigger population to be able to glean. And, one of the things, most of the country does work off county health systems. So a lot of CDC recommendation is built in that way, which is when, they issue stuff and they're talking about high transmission rate in the county, and everybody in Massachusetts is like, oh, county, what do I care? Well, the most of the country does work that way. So the fact that we have, 300 and something odd, almost 51 local boards of health and health commissions in every town sort of making their own rules is not probably the most effective way to battle a pandemic. So there's certainly room for it. And there's certainly times where we need to go in a different direction and look for top down, uniform standards. So, yeah, so I also was relieved that that DESE took the position that it took. So there was one other thing. All right, no, I think that's probably, anyone in the chat, anybody?
There is
Nothing.
nobody in the chat or anyone participating remotely apart from the
Okay.
members of the board.
All right, well, that's okay. They can watch us later. So we'll probably be, planning our meeting for later on in September. Obviously with the first week and the holidays, and then, everybody's sort of busy getting ready to go back to school. We want to have a little more data to see how September shakes out. If the time comes that, we need to look at face coverings as a mandate locally, obviously the numbers would dictate that. And if that's the case, we may have to get together sooner rather than later. But for right now, the trend seems to still be wobbling. So for, for intermittent contact, like going shopping or whatever, we still highly recommend face coverings, but in terms of a mandate, it still seems like virus penetration here is still, lower than would necessitate taking that action at this point. Obviously, this is the fourth time I think we've sort of started this, and hopefully this time we don't spike and go off the chart with case counts. But should the need arise where we need to be more aggressive, I certainly will call all three of you together and we'll hash it out.
Great.
Good.
Sounds good.
If there are no other comments, I move that we adjourn.
I second it. Or I moved. Oh, I second it.
That works.
It does.
All those in favor, please indicate who you are and what you want to say about adjourning.
I, Carol Ahern, agree. I'm in favor.
I, Shelley Reaver, in favor.
And I, Roger Christian, am in favor of adjourning. So thank you, everyone. It's
Yeah.
nice to
All right,
see everyone.
folks.
Thank you all.
Nice.
Yeah.
Thank you.
Bye-bye. Thank you.
Look forward
Thanks,
to-
Connor.
See you
All
in
right.
September.